So imagine this. A lot of you can probably relate. You recently graduated from college. You have a lot of student debt, and somebody offers to pay it off.
But then there's a catch. As 10 News reporter Colter Anstead explains, it's something that could be a reality if you take part in the new Tobacco Commission program.
Finding doctors and nurses willing to work and live in rural areas like Danville can be tough. John Kent, the chief operating officer of Sova Health's Danville campus, says nearby metropolitan areas like Raleigh-Durham and Greensboro provide a lot of competition.
With physicians in particular, sometimes we can recruit them to come and work here, but they want to live in another community.
That means Danville's economy loses out on a lot of the money they're spending on things like food and taxes. The Tobacco Commission's proposed new student loan forgiveness program is meant to change that.
What we need is the right number of new high-skilled individuals who can come and fill these jobs that we're having trouble filling. We have a high confidence that this is the best practice in this field.
People in certain non-healthcare professions can get $12,000 of their student loan paid off a year for up to 4 years. For healthcare workers, the Tobacco Commission will work with the Virginia Department of Health, which already has a loan forgiveness program. Anyone receiving money will have to live in Southwest or Southside Virginia for at least 2 years and be involved in the community.
I think it's a huge benefit over many of the other things that we've tried.
If the program is approved at the Tobacco Commission's meeting Thursday, applications could start being accepted in July or August. In Danville, Colter Anstead, 10 News, working for you.